We were originally approached, we were doing another life sciences deal back in 2012, and we were approached indirectly through Health Canada and some of the professors out at UBC, and looked at, we were asked if we'd be interested in funding an academic quasi-commercial entity on UBC endowment lands. At that time, as I mentioned, I was on the CNETS Canada board. I dealt with various institutions, and we weren't really interested prior to knowing where that space was going to go and what that space looked like. So over about a year and a half, we spent doing our due diligence, looking at how and if we'd get involved, and it became very clear to us that the pharmaceutical end of the endocannabinoid system was the key. So, I want to clarify, Medipure is not a medical marijuana company. We don't do anything with cannabis. We are actually, the holy grail for us is the endocannabinoid system. So the system's been around since 1992, was originally discovered. The last 2 decades is really when they've started to put significant science and research behind the system and understanding the mechanism. That mechanism is the key to all of our drug development. In 2014, we had enough information. We decided to spin out a separate company, Medipure Pharmaceuticals, and its parent, which wholly owns Medipure, is Medipure Holdings. The company is focused on drug development in an array of diseases, but all through the endocannabinoid system. So the diseases that can be triggered or affected and cured through that system, through that mechanism. Our drugs, we've got numerous lines of drugs. We focus on everything from the MP10X series, which is drug-based to compete and give physicians an alternative to opiate-based medications. So the 20X series is anxiety, mood disorder, PTSD medications. They are in competition with the SSRIs and the benzodiazepine market globally, and it's an interesting topic in neuropathic pain and the pandemic that we have with opiates in North America. In parallel, Europe doesn't have that same pandemic. Their pandemic is actually with SSRI and benzodiazepines. So if you actually look at, even in North America, for every 2 overdose deaths in opiate-based, 1 follows in SSRI and benzodiazepine overdoses. So it's quite a pandemic in itself. It's just not recognized as much because this is a bigger story. But the reality is we've got a lot of pharmaceutical drug side effect issues that affect our existing pharmaceutical drug base. We have a MP30X line, again through the endocannabinoid system, which is for skin disorders, psoriasis. The endocannabinoid system works on the inflammatory system. So as an example, with the skin psoriasis condition is an inflammatory disease that causes the psoriasis itself. We've got our MP40X is our proprietary molecule line. Those lines are being developed presently in Canada as well as in East Finland University under our control and design. We've got the MP50X line, which we just announced, and that is NASH drug-based. So that's for non-alcoholic steatohepatitic liver disease, fatty liver in layman's terms. And we're developing a new line which we'll be announcing more details on later this year in non-small cell lung and breast cancer oncology medications. So these medications are all based on, they're not cannabis based, but they're based on the endocannabinoid system.